Hello and welcome to my Division II MST Gateway. For my gateway, I researched HIV/AIDS in Los Angeles, California in 1981. Before I talk about my research, I want to talk a little bit about what an infectious disease is, an outbreak, an epidemic, and pandemic is, and what is the difference between them. So an infectious disease is disorder caused by organisms like bacteria, viruses, fungi, and parasites. Some of these cause disease and can be passed from person to person. An outbreak is the spread of an infectious disease in a contained area, for example, a school. An epidemic is a widespread occurrence of an infectious disease in a community, and a pandemic is the spread of an infectious disease generally crossing over large geographical boundaries, like continents or worldwide. The main difference between them is that they are lesser forms of one another, but what is still spreading in the infectious disease, the outbreak, the epidemic, and the pandemic is the infectious disease. So starting off in 1981, there were a few reports of people with rare lung infections, kinds of cases, and no one really knew what caused these rare lung infections or what they were. And so the first news broadcast was broadcasted about this weird about this weird rare lung infection and this cancer that nobody knew anything about. So here is the video.
Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer. Robert Bazell now in Atlanta.
Bobby Campbell of San Francisco and Billy Walker of New York both suffer from a mysterious newly discovered disease which affects mostly homosexual men, but has also been found in heterosexual men and women. The condition severely weakens the body's ability to fight disease. Many victims get a rare form of cancer called Kaposi sarcoma. Others get an infection known as pneumocystis pneumonia. Researchers know of 413 people who have contracted the condition in the past year. 1/3 have died and none have been cured.
Death didn't scare me. It was living with this for a long time. That's more frightening than death.
Investigators have examined the habits of homosexuals for clues.
I was in the fast lane at one time in terms of the way that I lived my life, and now I'm not.
The best guess is that some infectious agent is causing it. Today, researchers here at the National Centers for Disease Control said they had found several cases where people who had been sex partners both had the condition. The scientists say this probably means they are dealing with some new, deadly, sexually transmitted disease. The investigators see this as a serious public health problem.
From an epidemic point of view, there have been more deaths from Kaposi sarcoma and pneumocystis pneumonia than have occurred with all the cases of toxic shock syndrome and the Philadelphia outbreak of Legionnaire's disease combined.
Researchers are now studying blood and other samples from the victims, trying to learn what is causing the disease. So far, they have had no luck. Robert Bazell, NBC News, Atlanta.
So I focused some of my research on a case describing 5 previously healthy gay men who were showing signs of their immune system being suppressed, and so they were all diagnosed with this rare lung infection, or PCP. So many reports of similar cases were coming in, similar to the 5 gay men, and Kaposi sarcoma was one of the most common things that all these people, or most of them, were showing symptoms of. So this was kind of a big deal for a disease that nobody had any information on. All these people were showing signs of Kaposi sarcoma. So Kaposi sarcoma is a rare form of relatively benign cancer, but these cases were showing evidence of an aggressive form of Kaposi sarcoma. And another relatively common symptom that some cases were showing was an increase in pneumonia-like lung infections, so PCP. But at this time, not a lot of people were developing similar symptoms to one another, to this unknown disease, so there was really no official list of symptoms that everyone had. Many people referred to this undiagnosed disease as a cancer, and more cases of this disease started showing up in New York and in California. And because of the increase in cases, the CDC, which is the Center of Disease and Control, published a morbidity and mortality weekly report on the case of the 5 previously healthy gay men. At the same time, many people had theories on the possible conditions that these undiagnosed cases could have been. Some said that these were all symptoms from opportunistic infections, and opportunistic infections are so our bodies can fight off simple things like infections and parasites and bacteria and things like that because our immune systems are healthy. But someone who has a suppressed immune system can't fight off these infections, so these infections take opportunity of their immune system and go in and cause really devastating illnesses. And so at this time, everyone was saying that these were opportunistic infections, but nobody really knew why their immune system was being suppressed or why they were even having these opportunistic infections, so what the cause of them was. So many people were getting this undiagnosed illness, and since nobody had information on the illness, nobody knew how it spread. So I found a quote from the New York Times, and it said, "Dr. Curran said that there is no apparent danger to non-homosexuals from contagion. The best evidence against contagion," he said, "is that no cases have been reported to date outside the homosexual community or in women." So basically he was saying that people that aren't gay, there weren't really any cases of it, so they don't really know what is contagious about this disease, but they know that if you're not gay, it hasn't really been transmitted to people that aren't gay. So, yeah. And so a question that some people might have is what causes this disease to become contagious? So bacteria, fungi, viruses, and parasites all cause them to be contagious, and they can enter into the population from direct contact from person to person, animal to person, mom to unborn child, and food contamination. So as you can imagine, people that weren't gay didn't feel as if the illness would affect them as much. But they didn't know the reasoning behind this, so the public anxiety increased. So they didn't know why that they weren't being affected with this, and they didn't know if they were going to be infected with this, and it was just a matter of time. So many referred to this illness as the gay compromise syndrome or the gay-related immune deficiency, and other names referring to gay people. So this caused a lot of chaos for the gay community and others that were affected with this disease. So then in December of 1981, more drug users became infected with this unknown disease, and other people other than just homosexual people started to become infected with this undiagnosed disease. But there's still a lot of public anxiety of what this disease was, how it's transmitted, and what caused it. And so in this picture, you can just see some of the protests and the riots where they're talking about how they need to figure out what's going on with AIDS and not all this chaos. Some people brought up the question if this was just a sexually transmitted infectious disease, and so that was something that some people asked, if this was just some sort of sexually transmitted disease. So over the years, more cases started flowing in from Haitians and hemophiliacs and drug users. So the gay-related immune deficiency name was no longer needed and no longer made any sense to this disease because more people were getting it other than gay people. So as of September 28, 1984, AIDS became the new acronym for this disease. So why AIDS? So they chose the name AIDS because people acquired the condition rather than inheriting it. So that's what the A stood for. It stood for acquired. And then all these cases resulted in a deficiency within the immune system. And so that's where the I and the D come in. And then syndrome is because there are a number of many manifestations rather than one single disease. And so this is where that's why AIDS was chosen for the name for this disease. So even after they had this name, the transmission methods were still really unclear, and people still were extremely anxious about why and how this was transmitted. So some nonprofit organizations were established to support the people that were infected with AIDS, and so the San Francisco, so for example, some of these organizations were called the San Francisco AIDS Foundation, the AIDS Project Los Angeles, and the Gay Man's Health Crisis. And all these organizations kind of help people cope with their AIDS and give advice for safer sex options and some advice for prevention, even though they didn't really have too much information on AIDS. So there's a bit of variety in cases. The first child died from a blood transfusion that had AIDS, so where the blood was infected with AIDS. So this is kind of a big turning point for the transmission methods. And there are more cases coming up of pregnant mothers having AIDS and transmitting it to their unborn babies. So around this time, the CDC released a statement about the transmission of AIDS, and they said the cause of AIDS is unknown, but it seems most likely to be caused by an agent transmitted by intimate sexual contact by percutaneous inhalation of infectious blood or blood products. No evidence suggested transmission of AIDS by airborne spread, and the failure to identify cases among friends, relatives, and co-workers of AIDS patients provides further evidence that the casual contact offers little or no risk. The occurrence in young infants suggests transmission from an affected mother to a susceptible infant before, during, or shortly after birth. So after more research, they finally came out with how AIDS was transmitted. And so AIDS is transmitted through the blood and bodily functions of an infected person. And the way that this can be transmitted to someone else is through unprotected homo and heterosexual sex, drug use that involves needles, pregnant mothers to unborn babies, and blood transfusions. When I was researching, a member from the CDC said, when it began turning up in children and transfusion recipients, that was a turning point in terms of public perception. Up until then, it was entirely a gay epidemic, and it was easy for the average person to say, "So what? Now everyone could relate." So I was able to research the rate of infectiousness, or the reproductive number, and the reproductive number is the number of cases that one case generates over the course of its infectious period. This is determined by the transmissibility times the average rate of contact between people and the infected individual, and times the duration of the infection. So the reproductive number for AIDS is around 3 to 6 people. So this means that one person would usually on average transmit this disease from around 3 to 6 people. So many cases of AIDS started coming up in the countries other than the United States, like Europe and Africa, and it's now become a pandemic.